Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls at 866-870-5752. You get a free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, and it has 264 scientific studies. What do you think?
I love it. It's also got a chapter beside all the musculoskeletal stuff on platelets and stem cells, how to heal your body without surgery. It's got a chapter on hair regeneration using the same process, and on the vampire facelift, which is a process of making your face look young again, regrowing the collagen. As we age, the collagen in our body starts to dry out. And this happens in our joints, but collagen is the major constituent not only of cartilage in our joints, but it's also the major constituents, the major protein of everything in our body, our blood, our hair, you name it, eyes. So it's very plentiful, but it does start to deteriorate as we age. And I love telling the story about my father, who was about 6'1" when I was young, and then he shrunk up when he got to be 90 years old. And what happens is the discs, the intervertebral discs, are a collagenous kind of material, fibrocartilage, and they often will dry out and shrink down. That's called degenerative disc disease. It doesn't cause pain, so be careful if your doctor wants to do a surgery on your neck or back because you have degenerative disc disease. That is not a good surgery. That shouldn't be done, in my humble opinion. And by the way, I love to say this in every show, I love surgeons. They do the hardest work in medicine, but the orthopedic surgeons, I think, in my humble opinion, have to say my opinion, because I'm not the god of medicine. I'm just me doing my work of stem cells and platelets, of regenerating tissue in the body instead of cutting it out. I love the surgeons. I used to love doing the surgeries when I was in my training. But after a shoulder surgery on my body that failed miserably, I jumped ship and I learned about regenerative medicine, healed my own shoulder, injected it in the evening as an experiment, woke up the next morning, full range of motion and pain-free. My wrist took more injections. I had it done at a regenerative medicine conference many, many, many years ago, and it got about 50% better overnight. I then self-injected it a few more times. That was a little bit harder to heal. And that's one of the things about using platelets and stem cells. We never know if a body part is going to heal or how many treatments it will take to have it heal. Nita, you're so squeaky today. I'm going to have to hit you with a joke.
Oh, a joke. I would just love to have a joke.
I know you're not telling the truth there, but
No, I really would.
You really would?
Yeah, because I like to challenge my brain.
Okay. Then why did the strawberry cry?
Lost its seeds.
Well, that's not bad. But he found himself in a jam.
Well, that could happen.
Okay, here's another one. You ready?
Okay, yes.
How did the barber win the race?
By cutting corners.
I like that. He knew a shortcut. I'm going to give you half a point for that one.
Oh, half a point. Yay!
I'm reading this one. I don't understand it. Let's see. Okay, I got it. What did 50 Cent do when he was hungry?
Oh, gosh, I have no idea.
Oh, this is a hard one. 58.
I never would have.
No one would.
Okay.
These are hard ones today.
Who's sending you all these hard ones? We have to get them off your email.
I know. Well, our patients send them and they think they're funny.
I know.
Okay, here's another hard one. You ready?
Yes.
This is funny. Why did an old man fall in a well?
Because he wasn't paying attention.
Close. I'm going to give you half a point. Because he couldn't see that well.
That's a good one.
Okay, this is a good one too. But you're not going to get it. Maybe you will. I'm going to give you a hint.
Okay.
The hint is, first I'm going to say the joke.
Okay.
Why is Peter Pan always flying? Okay? And
to get away from Wendy.
Well, that's true, probably. But we can't say that today. Someone will be offended.
Okay.
Think of where he lives.
Think of what?
Where he lives. Why is Peter Pan always flying? Because he never lands.
Oh.
Remember Neverland?
Yes. I forgot. Okay.
I love these jokes.
These are really...
My family hates when we have parties, because guess what I do the whole time?
Oh, that's funny.
I crack these terrible jokes, and everybody's rolling their eyes. One more, because I love this one. You ready?
Yes.
What do you call a hippie's wife?
You call a hippie's wife...
Mrs. Hippie.
Mrs. Oh, I never would have got that. That's a good one. That's a good one.
I could do this the rest of the show. They're so
I know,
funny.
they're really funny.
People are probably not liking me right now.
Okay, well, we could talk about...
I'm going to actually ask a question here.
Okay.
Not to you, but it's actually a question that was asked of me. So, number one, if you want to call in and talk to me and save Nita from getting tortured by terrible jokes, the phone number to the studio is 866-870-5752. And if you want to call my office, you can talk to someone. They're live right there, and they will give you a free phone consult. And the phone number of the office is 800-300-9300. If you'd like to email me, if you're shy, I hope you're not shy. Just pretend when you call in it's your mother or something. But if you want to have your questions answered by email, go to www.jointrehab.com. And that's my website. There's a spot on every page to email me. And there is also endless numbers of videos of me doing these procedures of platelets and stem cells and some prolotherapy, I think, from the old days. And you can actually watch and see if these procedures are something you'd rather do than have a surgery. All right, so this one is instability after knee replacement. Uh-oh. So this person says they have knee joint instability after knee replacement 2 years ago. Thank you. I appreciate listening to your show and all the great work you do. Well, thank you. So knee instability after knee replacement, very common. I have seen many people come in the office for something other than a joint replacement. Let's say they had a knee replacement, they came in for their shoulder, and during the history and physical, I find out that a knee replacement that came out good. So I'm not against surgery. I'm against doing it when you don't need it. Did this person have a surgery they needed? I don't know. That's not enough information. I haven't met this person. It's just a question that came in from my website. Most people that come in ready for a knee replacement, that means they've been to an orthopedic surgeon, they've been told they need a knee replacement, a shoulder replacement, a finger joint replacement, something of that nature, hip replacement. We work on them and they don't need to get the surgery done and they get better. How can that be? The culture of medicine today is still, to me, in the dinosaur age of doing surgery when you don't need it. If I thought surgery was a good thing, I would be doing it today. All right? I was in line to get a spot in an orthopedic residency program, and then I had my own shoulder operated on by my boss, came out bad, and I decided to go into physical medicine and rehabilitation instead. And that's where I learned about regenerative medicine, and I am so grateful, for my career of doing regenerative medicine rather than surgery. I see way too many people come in after a failed surgery. I'm not saying it's a botched surgery. I'm saying it's a failed surgery. That's different. It's not blaming the surgeon. It's just something that can happen when you do a surgery. Things come out bad sometimes. And I'm a witness. I can testify to that with my shoulder. I had the surgery. I was very excited to get the surgery. It was just a weightlifting injury. Really, it was a sprain. That was basically it, of the supraspinatus tendon. And so I had the surgery. I had part of my acromion, which is the bone on top of the shoulder, cut off. And I had ligaments around the shoulder joint cut. It was called a decompression, a shoulder decompression. Came out bad. My arm was swollen with fluid. I had a fever, and I really couldn't do much with that arm for about 4 years until my senior year of residency. That shoulder surgery took place in my 4th year of medical school, and I experimented on myself, and I injected myself. The funny part, as a lot of you listeners know, and a lot of my friends who are listening know, I came home with some syringes, and I got in bed with my wife, who was watching TV, and I pulled out the syringe, and she knows I'm a little bit kooky, and I started to inject myself, and she started using expletives on me, and it's like, what do you think you're doing? And I said, I'm going to heal my shoulder, just like I healed my wrist. And so I injected my shoulder. I woke up the next morning 100% pain-free, with full range of motion, with a shoulder that I could go back to doing sports with. And I want to let you know, this may not be the way you heal. A lot of people heal quickly, and a lot of people heal slowly with many treatments. I then injured my shoulder about 12 years later, same shoulder, different injury, and that one took 2 treatments of regenerative medicine. Then, I don't remember how many years after it was, I can't remember, sorry, I injured my shoulder even worse, different injury, and that took several injections. It took a few months to heal. So a lot of people come in who've been to see me years ago, and I tell them it may take several treatments, even though they healed fast before. And they go, why would that be? And I go, because you're 20 years older now, maybe? You know, It's not the same injury. The tissue's more worn down than it was. Who knows? Healing is a strange thing. So there's no guarantees. I do know it's safer to do conservative things in medicine than to do invasive things. So I'm going to go to, unless you have something to tell us, Nita, I'm going to go to another
No, go
question.
right ahead.
All right, let's see what we got here. And by the way, back to that question on, you need some oil on your chair, Nita. Back to that question about the knee replacement. There are a lot of people that I can help even after a joint replacement, but I can't do anything inside that joint for several reasons. One is it's not biological material anymore. We're not going to grow tissue inside. And 2, we rarely want to put a needle into a non-biological area, like a fake joint, because if you're introducing bacteria with the needle, which can happen, you can create a terrible infection. Now, this doesn't frequently happen when you're injecting in live tissue, because live tissue has a blood supply and it cleans itself out. But to go into a joint replacement, very rarely will I do that. Maybe if it's filled with fluid, I might consider it and use very, very sterile technique. But it's not something doctors like to go near. But even with the joint replacement, sometimes on a knee or a shoulder or a hip, we'll find areas outside the joint that are actually the pain generator. And we can inject that and help that heal. So that just depends. Usually, though, if it's a joint replacement, I'm going to stay away from it. So here's a cute little question. Can a 72-year-old get PRP? So, hi, Dr. Darrow. I'm 72 years young. Am I young enough to generate therapeutic PRP? Thank you for your time. They give their name. I won't say it. Well, everybody has PRP in their body. They've got platelets in their body. But when we take the blood and we spin it, we're concentrating. That's why we call it platelet-rich plasma. So if a person normally has X number of platelets and a certain amount of fluid, we can, by spinning it, concentrate it to maybe 5 times or 8 times what's in the blood. And what the platelets do is they stimulate a healing response. And the platelets are the first cells during an injury to go to the area and create a healing milieu. So what we can do is we can take an area. This person doesn't say where they are injured or where they're having pain. But the crux of this particular question that I'm reading it is because they said they're 72 years young. Well, I'm 75 years young, and it works on me. I've treated people 100 years old, and it's worked on them. So we get patients who are in their early teens, and we get patients who are 100 years old and everything in between. Does this work on everybody? Well, it's not going to work on everybody, but it could work on everybody. The age, to me, is not a limitation. Same thing with stem cells. A lot of people come in, they go, I don't want to use my bone marrow because I'm old. I want to use something else that has young stem cells. To me, it's a lot of malarkey. We've done it all. It all seems to work. And there's a lot of pundits in every field, and there's pundits in the field of regenerative medicine. I typically don't listen to them. I get my own results. I know what that is. We do our own research in the office. We have college students. Actually, we've had some high school students that will shadow me or Dr. Grove, and means follow us around. And then they will often do research studies. We have one that's actually sitting on my desk right here, right now. And let me see what the title is. The Long-Term Outcomes in Treatment of Knee Osteoarthritis with Bone Marrow Concentrate. That's stem cells from the bone marrow. And it's a long-term study. This goes up to, I think, over 4 years after the treatment, showing the success long-term. We have other studies. If you go to the website, www.jointrehab.com, there's a page that has other research studies that we've done. So we continue to do research, and I love having our students follow us and learn about medicine. A lot of the students that come in are in college, and they're trying to get a slot in a med school, which is really tough today. The research, getting their name on papers, helps them get in. We have medical students. We actually have residents. I've had tons of residents from all over the country, actually from other countries even come in. And I've had a lot of doctors from other countries come in and study with me. So we're very active with research, with learning the newest methodologies. And be careful what you read on the internet about regenerative medicine. A lot of it is just fluff from guys who aren't really doing much of it, guys who are using it for advertising. I'm not going to mention any names, but there are people who poo-poo everybody else, and only they are the one who should be doing it, and that's ridiculous. This is not a hard procedure to do. You just have to go to, if you're a patient, go to the guy who does the most. Don't go to a chiropractor who hires a doctor for a day. And by the way, I have nothing against chiropractors. I go to chiropractors. My favorite one at the moment is Dr. Randy Weinzoff in Santa Monica, California. And I send him all of my radiculopathies, patients that I can't heal, that are having arm or leg pain from a pinched nerve. Most of the time we can heal them, but when we get to a dead end, we'll send them to him. He does the same thing for us. When he gets to a dead-end patient and he thinks regenerative medicine of platelets or stem cells can work, he will send them to us. So, medicine to me should be everybody gets together in one pot and helps each other, because I can't help everybody and the other doctors can't help anybody. And it's a shame that the surgeons are not getting into regenerative medicine. A lot of them will do it as a side gig, and it helps them get patients in the office. But my friends who are orthopedic surgeons don't believe in it. They do it, and then they say it doesn't work. And I go, well, why are you doing it? And they say, well, I want to try it. It's not something you try. It's something you do. And if you're not doing it much, you don't know how to do it. So, need anything before I go to another question?
Yeah. You can call us, 866-870-5752.
So here is a question about our book. Would you please send me a free copy of your book, Regenerate, Don't Operate, so I can familiarize myself with what you folks do, whether it might be appropriate for me. They give their home mailing address. Yeah, we will send this person a book. Actually, probably have already. So, to me, it's a terrific book. If you don't want to get a surgery, I would read this book. And even if you do want a surgery, I would read this book, because surgery may be the avenue that is not good for you. And regenerative medicine, to me, is a very simple procedure. This book has all the reasons why not to get surgery. So you have to be careful and understand. I don't like when people get surgery. I'm just saying it the way it is. I'm transparent. Why is that? I had a bad shoulder surgery, suffered from that for years, and I see too many people suffer from having surgeries they did not need. After injecting myself, it healed overnight. My shoulder, my wrist was 50% better overnight, and then I injected it myself a few more times. My wrist and shoulder have not bothered me for many, many, many years. So I'm very fortunate. This is a great book. I will send it to you for free. I think you'll like that. It's a $25 book. It's got, here I'm looking at page 67, which is a photograph of pedicle screws in the spine. If you see this, like the first time I saw this during surgery rotation, I couldn't believe how big these screws were that went into the spine. And the doctor who I studied with was the head of orthopedics, and I wanted to get an orthopedic residency. So I studied with him, I did research with him, and he had his failures. It happens.
Should we catch Cheryl real quick before we run out of time?
Thank you for the reminder here. Let me go to Cheryl. Does your treatment help trigger fingers? Good question.
Hi, guys. I have a trigger finger, middle right hand, treated once with the steroids. He wanted to do surgery, but all of the surgery prep with my other health problems made me too nervous.
Okay.
And I wondered if these kind of treatments help a trigger finger.
Well, let me ask you a couple questions. It's too late. Go to my website and you can ask me a question there, and I'll give you a call. And the phone number is on the website. But you can go to www.jointrehab.com and email me your question, and I will personally call you back, okay?
Thank you, Cheryl.
If you want to get a hold of the office, get a free consult with my staff. The phone number is 800-300-9300. God bless you all.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab and sports medical center experts for free, and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.